Hey, friends, and welcome back to the Booze Free Babes podcast. Booze Free Babes available on Apple, Amazon, Spotify, and a full video replay on YouTube. Today, we are joined by Julie Bass. I am so excited to have her on the show today. So let me just share a little bit about Julie Bass. So hang on with me, guys. Julie Bass, board certified psychiatric mental health nurse practitioner offering a comprehensive psychiatric evaluations and medical management with a focus on integrative, nutritional, and reproductive psychiatry, as well as thoughtful medication optimization and reduction. She works with patients who feel unseen in the traditional volume-driven systems and is looking for a more and working with people that are looking for a more intentional, personalized approach to their mental health care. And that's Lilly Mental Health. She's it's my pleasure to introduce to you Julie Bass, board certified psychiatric mental health nurse practitioner and founder of Lilly Mental Health. We're so excited. Lilly Mental Health. Julie specializes in integrative and reproductive psychiatry and is passionate about helping adults receive thoughtful, high-quality care rooted in both clinical expertise and lived experience. Julie, I'm so excited to have you on the show. Welcome.
Thank you so much for having me on.
I know that was a mouthful, y'all, but I wanted to make sure I shared her full bio because what Julie's bringing to this conversation today is a lot of knowledge and a lot of lived experience. So we want to chat through all of that. So tell us, I know we met at a Booze Free Babes event like a year or two ago.
Years ago, yeah. So shortly after I moved here, so 2023, I believe.
Wow, I can't believe that we've been connected for so long and that it's already 2026. So, Julie and I first met at the Sachet event, which was a non-alcoholic bottle shop in downtown Charleston. So, Booze Free Babes hosted a little, sip and shop type event, I guess you could say. And it was a lot of fun. It was our first time doing something like that. And Julie showed up and supported us. And we had a great time hanging out in downtown Charleston on King Street and sipping and shopping and chatting and having yummy cupcakes. And so I'm so excited that this has become a full circle conversation because Julie has since then opened her practice, Lilly Mental Health. So share a little bit about how that came to be.
Yeah, so it's kind of a, long drawn out story. Looking back, I've always been very interested in mental health. I've worked in different mental health settings since about 2011. And then, worked in psychiatric nursing since 2016 and always kind of had this vision to create something different. I'm personally in recovery myself and just really know what it feels like to be on the other side of that and feel very, dismissed or unheard. And I think, there is a place for, mental health care right now with the symptom checklist and kind of medication checks, but I kind of, resonate more with people looking for something a little bit deeper, kind of look at their medications and want more of that personalized experience beyond, the symptom checklist.
Love that because here's the thing. I feel like what happens oftentimes, I don't want to say all the time, but what can happen is that when we're in medical assisted recovery, that it's like we put you on this dose and then that's the dose that you ride off into the sunset with for the rest of your life, right? And that's where I feel like you've really created this beautiful conversation in psychiatry and in recovery. So I'd love to do a little bit of a deeper dive on some of your beliefs around that.
Yeah, I think, medication is a very polarizing and controversial subject, and I kind of find somewhere in the middle where I don't think it's a magic pill or a quick fix, but I also don't think, they're demonized the way, sometimes people are like, they're all bad. I think, always getting to the root cause is ideal, with like functional labs, lifestyle and sleep, but sometimes when you're experiencing those constant fire alarms, it's really hard, to think about nutrition or, structure and routine, so that's where medication can come in and be helpful. To kind of let you work on therapy and lifestyle, but the key is, to kind of constantly reevaluate. Is this medication still needed? Is it helping? Is it possibly causing side effects? And I think a lot of times that's where medication gets a bad rap because, like you said, they're started on it, sent off, followed up every 3 to 6 months. Anytime a new symptom pops up, the dose is escalated, and then it's 10, 15 years later and nobody has ever said, what was this medication started for? Have circumstances changed? Is there a better option? And I say a lot of times too with stopping medications, that needs to be done intentionally as well, because we know about 50% of the population will have some kind of withdrawal, from any medication that acts on the central nervous system. So kind of taking the time with personalized hyperbolic tapering versus just, linear reductions that may lead to withdrawal.
Wow, that's fascinating. I didn't even think about that, but it's so true. And then I feel like a lot of times if you go to a general practitioner, they're just picking whatever is in season right now, right? Let's try this. Let's see if it works. Come back in a couple months. If it doesn't work, we'll try something else. I mean, that can be a really long, bumpy road. And I'm just speaking from my own experience, trying to dial that in and get it right. I mean, and the other thing I want to point out is that alcohol, or whatever your DOC was, but for me it was alcohol. So that was my relief. That was me choosing a solution, right? Like that was the way that I was choosing to self-medicate underlying issues. And so I think it's really imperative that we touch on the psychiatry piece of this, because oftentimes what we find in addiction is that there's still something underlying, and we've just been misdiagnosed, and we used our alcohol, drugs, whatever, to be that self-soothing medication, right? So can you just hit on that a little bit?
Yeah, I mean, looking back on my own personal history, I can definitely see that in myself. My history with alcohol in high school, I never drank. I was a goody two shoes. But as soon as I got to college, I think I knew pretty quickly that I was not a normal drinker. It was just always drinking to the point of to get blacked out, not remember. And I kind of, stayed in that space for about 18 or 20 years of starting and stopping, doing good for a little bit. And I would, over those 15 or 20 years I was in that space, every once in a while go see a provider, and I just always felt so dismissed and unheard, that they were just saying, you have this group of symptoms, that equals this diagnosis, that equals this medication, and just not looking at all, about like, why are you drinking, or, how's your sleep, and just so much being missed in that picture of just reducing it to this diagnosis equals this medication, and not thinking outside the box. Yeah.
Right, right. And when we can dial in that root cause, I feel like that's when some real recovery can begin, right?
Yeah.
And I mean that, like, that's where we can take that recovery to a deeper level. In the beginning, I feel like it's just about eliminating the substance and learning how to live a life without the substances. And then what can happen, or at least has been my experience, is that the noise trickles back in, right? And you're like, where's all this noise coming from? And so we learn coaching, we have our toolbox, we learn our tools that we can pack in our toolbox. And this is just one more tool that we can take along this journey. And so it's really, really, really helpful. And I know that you said that you're in recovery too. Do you want to share a little bit about how that's impacted your practice?
Yeah, I mean, I think it definitely comes into play, every day with how I practice and how I view healthcare. I just really, one of my core components is I don't believe in quick fixes. I think, quick fixes don't last. Anybody that promises a miracle reset or the cure for all, I'm always very skeptical for, because everybody's, individual, different lived experiences, and, recovery especially is so individualized and personal. Just thinking, I'm always very big on making small changes, what's going to be sustainable, long term, not just when you're feeling very motivated or having a good day. What are, kind of small incremental changes we can make to kind of examine, with your relationship with alcohol or whatever the substance is really, how it's impacting you and what is it doing for you, because it's obviously serving some purpose, just kind of breaking that down and finding ways to replace it.
Wow, that's fascinating. I love it. And so walk us through what that might look like. Just share with us maybe what a couple of those small incremental steps might be to help someone on their journey.
I love nutritional psychiatry. That's a big interest of mine. There's a lot of different words thrown around with, integrative psychiatry, nutritional, metabolic. They all are a little bit, individualized, but under that same kind of general umbrella of integrative. But the nutritional psychiatry just kind of more looks at, how is your food affecting your mood, possible inflammation. There's a lot of, different diet patterns out there. People respond differently. So just kind of seeing, what works for you, and then maybe looking at some labs, nutritional deficiencies, things like that.
That is fascinating to me because I actually just came across a video on TikTok. Believe it or not, I just saw this video, and it was it was a Russian influencer, and she said what she didn't understand about American women is that we don't like go get our labs and look at our labs and adjust our diet based off of our lab work. And so one of the things that she mentioned was ferritin. And so don't you know, I went and checked my ferritin levels for my most previous lab work, and I'm like non-existent. And so I was just blown away by that because that could be, and I actually ordered some supplements. And so I'm going to start
Yeah.
taking it and see what kind of change it does to have an impact. But I was just blown away by that. And so it's fascinating to me that you're able to tell just, I mean, obviously our food, if people have a high processed food diet, that is definitely going to impact your mood and the chemicals and everything they pump into the processed food. And I'm not going to get on that soapbox, I promise. But, eating like food that is meant to fuel your body is gonna make you feel better. And I feel like when I first got sober, I just wanted fruits and vegetables so much. And especially fruits because I feel like I was also dehydrated too, and I just couldn't get enough water intake. And I feel like fruits replace that too, right? Um, I'm sure there's some insulin spikes that happen there too, but just trying to get that hydration in. So that's fascinating. I've never heard the term nutrition psychiatry, so I'm
Yeah.
fascinated.
And there's lots of, different spheres of that. Like there's a lot of evidence for Mediterranean diet and keto as well. But like I said, I'm always just big on what will work for you long term because I think, keto has its place, but for a lot of people that can induce, more anxiety or stress or kind of that perfectionism. So,
Yeah, keto's hard to adhere to. I'm
yeah,
more of a fan of the low carb.
yeah. Moderation.
There's a little bit of room for error there. You don't have to track as much.
Yes.
Wow, fascinating. So I love that. Okay, so first thing we do is we chat about nutrition, and then what's another thing that you focus on?
I really just enjoy. I'm a pharmacology nerd, so I really just enjoy, taking a look if people come to me on medications, like what is each one doing, and then just kind of really looking at each individual medication profile. If we are going to go that route, what might be the best, choice for you? A good example with that is the SSRIs, so like Prozac, Zoloft, and Lexapro. They're very common, in kind of what they do, but they all also have individual profiles as well that might, affect one person differently. So just to try to be, really intentional with the pharmacology, and like I said, in constant reevaluation, is it still needed? Is it helping? And if there may be a better option.
I think that's fascinating because here's the thing. The doctor, that's the first thing they're going to do is they're going to prescribe an SSRI. Try this one, try this one, try this one. And it's frustrating because, you feel kind of funky for a month and then you're waiting to get back to the doctor and then you might need to change it and now you're feeling funky again because you got to come off of this to get back on something else. So it's very frustrating to navigate that. And I think that what the service that you bring to the table, obviously having being a nurse practitioner number one, so you're able to explore these different medications, but just taking the time to understand the individual, understand their individual labs and what's going to work best for their chemistry in their own body, right?
Yeah, because I see that a lot of times, people will come and they've been started on 5 or 6 different medications within 6 months, and then the picture is just so muddied at that point. Whereas, are you having withdrawal from one of the 4 or 5 that's been stopped? Is the dose incorrect? And just, a lot harder to kind of dissect what the root cause is at that point.
And let's just say this, like if anybody's listening to this, I just have to say it from this perspective. Obviously, we all start with our general practitioner, right? To try to dial it in. But if you're catching this conversation, maybe that first call could be Lilly Mental Health, right? Because if you're exploring medical assisted or if you're exploring regulating anything and want to have that conversation about what medications might be helpful to navigate that a little bit easier for you, then I think it's really beneficial to talk to somebody that this is exactly what they do. And it sounds like at Lilly Mental Health, that is your focus, is dialing in on those things that are going to be most supportive and helpful in a supervised environment versus the general practitioner and listen, no shade, no shade. I get it. They're busy,
No,
insurance.
they serve a great purpose. Very, just too, if you want that deeper look, or said especially there's been a lot of failed trials, and that's we're kind of taking a deeper look because PCPs and general practitioners definitely do a great job. Yeah.
Yeah. They're doing what they're allowed or able to
Yeah.
do in the short period of time that you get to spend with them,
Mhm.
right? But here we're talking to somebody who's also going to walk us through that from a therapy perspective and from a medication perspective. So I think that just really is more of a let's go to the one-stop shop and let's get everything that we need in one place. And it sounds like that's exactly what they're able to do at Lilly Mental Health.
Yeah, that's why my intake appointments are 60 to 90 minutes because I really like, think that first appointment is so crucial to get the background information, make sure the diagnosis is correct because, the incorrect diagnosis can set you off on years of incorrect treatment. You're just kind of not understanding the full story.
Wow, I feel like I need to schedule my appointment now. You want to walk us through an intake, just roughly, just kind of what you go over during the intake process.
Yeah, so my whole, thing is I try to be very low pressure, low key, just try to create a safe space for people. We usually start out, just kind of seeing what their background is, what previous experience they've had with mental health or psychiatry. I always like to allow, the first part of the appointment just to kind of hear them talk for a little bit, what brought them in, what kind of encouraged them to seek help now. And then the first appointment is really just kind of, more of a broad overview, kind of different assessment areas, like sleep, mood, anxiety. I like to, kind of understand their developmental history, social history, substance use. And then we kind of use that as a base point to get a general plan together, what might be going on. And then like I said, may or may not include medications. I'm always, very low pressure. I say, if you want to think about it, I'll send you some information on ones that may be helpful. So it's kind of, not like the appointment we have to start a med today and I'll see you back in 6 weeks.
Right, nice. Okay, so here's what I heard that I think is really important is that you start with a baseline and a base understanding of this individual. And I don't feel like, in my experience, I've had that in other therapy settings. So I think starting with a strong foundation and a strong understanding of what life experiences may have impacted that person and then being able to curate
Yeah.
your care around that sounds really helpful.
Yeah, because we know that these, conditions or symptoms don't exist in isolation. Depression or anxiety are not just serotonin deficiency, or it's not all one thing. Just to kind of get that whole picture to see what we might be missing, versus just a checklist and okay, this equals this and case closed.
Wow, that's so exciting. I can't wait to have my opportunity to have a session with you. We're going to have to schedule that after
Looking
this.
forward to it. Yes.
At least let me experience the intake and then we can go from there.
Yeah.
Okay, so tell us where to find you, Julie.
The best way is usually my website. It's www.lillymentalhealth.com. Kind of has my background, info on the practice, and you can also book directly. I'm also on Facebook, Lilly Mental Health, and then Instagram, Lilly Mental Health, PMHNP.
Fantastic. And do you offer in-person and virtual appointments?
Yep, I have both. I do telehealth virtual across South Carolina and Massachusetts, and then I have in-person options in Charleston, and then I will be having in-person in Boston coming up in the spring. So,
Wow, that's so exciting. I had no idea that you were branching out to Boston too.
yeah, I have previously in my last position, I saw patients in Colorado and Massachusetts, and I really missed my Massachusetts patients, so I got that added in January.
And so for the in-person thing, you're just gonna cruise up there like once a week, a month or something
My
and
plan
see
is to
everybody?
start off with like maybe bi-monthly as my caseload grows to kind of see what the demand looks like, and then kind of base it off of that. I have the office is available every Friday, so I'll kind of see how that picks up.
Well, that's so exciting. I'm really excited for you. I know that when you had first moved here, it was before you had opened Lilly Mental Health, and I think that was probably in the works of the direction that you wanted to go. So it's just so exciting, you know, coming back around full circle and reconnecting with you after these couple of years and seeing
Yeah.
how much your practice has grown and we love being a part of that journey too. So I hope that if we have any listeners out there in the Booze Free Babes universe and you're navigating medical assisted recovery and or any type of medical assistance, right? Then this might be a conversation worth having. Schedule the 60-minute intake and at least see what is available to you. And I'm going to do that for myself. I think it's, we were sharing before the call. I had a stressful morning here at our house with with my mom. And so it was just funny. I was like, okay, I'm coming in a little hot this morning, but we're here.
Showing
Just
up, that's
cool
all that
pants.
matters.
So I really appreciate you being here today and sharing about Lilly Mental Health. So is there anything else that you would like to share with our audience about Julie Bass or Lilly Mental Health that you think could be helpful on their path to recovery?
I think that's kind of, my general philosophy with care. One of my favorite quotes is Ralph Waldo Emerson, "What lies behind us and what lies before us are tiny matters compared to what lies within us." And I just, really believe that to my core, that it's never too late, and as long as you have that fight, and breath in you to keep fighting.
That's beautiful. I love that quote. I'm gonna
Yeah,
have to
love
I'm
it.
gonna have to put that in the show notes. So Alexa, make sure we put that in the show notes.
Definitely.
I love it. Thank you so much, Julie. I
Thank you so much
appreciate
for
you
your
being here.
support. Yeah, it was a great time. Thank you.
We'll make sure that we have all of Julie's contact information in the show notes so that way you guys can easily access her, and let's show her some love and support. Go check out her Instagram, Facebook, and definitely check out her website. So I'm going to let you drop that one more time for us.
www.lillymentalhealth.com, and just one L for the Lilly.
Fantastic. And then also on Facebook and Instagram, Lilly Mental Health. I think Instagram was what was the, Lily?
Lilly Mental Health PMHNP with underscore.
Got
Yes.
it. But here's the deal: if you search Lilly Mental Health, you're going to find it.
Pop up, exactly.
Fantastic. And is your office in Charleston or is it in Somerville?
Right now I have Somerville and West Ashley. I'm actually getting ready to condense to a different Charleston wellness workspace, but it'll also be in West Ashley off of Sam Rentenberg.
Well, for those of you that don't know, I also live in West Ashley. So that's really great for me.
Very convenient.
So I'm going to get to see you a lot more often.
Looking forward to it.
Fantastic. All right, Julie, thank you so much for joining us today. We'll get this out as soon as we possibly can for everyone. I'll make sure that we copy you on it. And hopefully, all of our listeners will go check out your social media and book their intake call with you. That would be fantastic.
Yeah, sounds good. Thank you so much again for your support.
Thanks, Julie. Thanks, Lilly
You
Mental
take care.
Health.
Thank you. Bye.